In this video, 5 mothers talk about their personal experience using TRE during and after pregnancy. They speak of the diversity of their experiences to try to capture the variety of viewpoints and insights. Please note that this is not medical advice. It is still important that you consult your doula, midwife, doctor, or other healthcare practitioner before using this technique during pregnancy.
TRE was with me the whole way through both of my pregnancies, my births, and postnatally, and I still use it now. And throughout the first trimester, I was shaking every single day. I shook every day throughout the whole pregnancy. First trimester, I wasn't feeling the best, but I would still shake anyway. I made sure not to have any jerky, big movements. It was just very gentle. It just really allowed me to kind of just take a breath and take a pause. And so actually, it was really helpful. And then throughout the second trimester, as I was getting bigger and as it wasn't so good to just be lying flat on my back anymore, I would sort of prop myself up at an angle on some bolsters. And I would do some gentle yoga. I would shake at the slope for a little while, and then I would fall asleep into a lovely nap. And that was just something so nice that I would do every day, and that felt really, really good. As I moved into the final trimester, something really amazing would start happening. So I would shake only sitting up, but my body just wanted to move in this kind of spiraling motion, and it was just amazing. I just knew that the baby was getting into position, and it wasn't movements that I'd ever done before. My body just wanted to move in this way. I told my doula and my midwife about TRE so that they would know about it for the birth, and I had 2 home births without complications for both of my babies. And I shook in between the contractions. The births were, not easy, but nothing bad happened. And by the end, what both the midwives and the doulas commented on was how quickly I was able to deliver the placenta, which is something that I hadn't even considered, honestly. And then something else that was just amazing was that afterwards, within the first few days, I would be lying in bed, not even thinking about doing TRE or yoga or anything, but I would find that my body would just kind of start this really intricate movement deep in my abdomen and deep in my pelvis. And I could just feel that there was some very, very deep activity happening, as if it was just beginning to put myself back together again, just very gently. That's how it felt. As the days and weeks went on, when I started to lie down and, get in place for a proper shake, as it were, I would find that my body wanted to lift my hips and pelvis up. And it was almost as though my body was stitching its abdomen back together again. It was absolutely incredible movements that I would never have dreamt of being able to try, but my body was doing it. And yeah, I had no problem physically after either of my births. And yeah, everything was back to normal, as it were, pretty soon afterwards. And yeah, I still shake almost every day just to deal with the stresses of being a mother with 2 young children. It's just a really good way to release tension and irritation, frustration, that kind of thing. That's just kind of what I use it for now. So yeah, I would 100% encourage anyone who's thinking about doing TRE.
Okay, so my name's Alice Payton. I'm a certified TRE provider, and I've been doing it qualified since 2015. My background is craniosacral therapy, so I had already had experience as a craniosacral therapist and working with a lot of babies before coming to TRE. When I got pregnant, in fact, I've got 2 children who are 2 and 4, but in both my pregnancies, I was very sick and vomiting for the first half of both of them. So actually, I did no TRE in the beginning because I felt too ill. And actually, it worked better for me later on when I started to get sciatica and pelvic pain. And something it really helped with was the sciatica. So that was great. because I was doing pregnancy yoga and stretches, and the TRE really helped to get a bit deeper. And in my second labor, when I was in labor, I had both my babies in hospital. And during my labor, I was sitting up on the bed, and the TRE was happening. So my body was shaking, and then I was like, okay, no, now it wants to do TRE. So that really helped to kind of calm my nervous system. So, I mean, there's in labor, you're kind of feeling all the pain, and I had kind of no pain relief in either of my labors. And it really helped to kind of calm me, but also to help this intense contractions. So that was really great. But what I kind of focused on a lot more was TRE postnatally. So helping with the kind of new way of life, with adapting to having a baby, adapting then to having 2 babies, adapting then to life, as a 4 in a household. So all of the challenges that come with that, and particularly the mental workload of being a mother. So I think, like Jane said, the daily stresses of being a mother and everything that comes with it, that's what I've really focused on. That helps to calm my nervous system, the irritabilities, the stuff that even though we do TRE, we still get annoyed and pissed off at stuff, but it really helps to calm you and able to deal with kind of stuff. So it really kind of helped, I think, I suppose, to then speak to other parents as well, and telling them actually, like, this is quite a useful tool to help after having children. And so I'm working with mothers in my area now to help deal with these kind of stresses, but also many mothers have kind of minor injuries or issues with bodies, issues with babies, issues with sleeping patterns. There's lots of disruptions after birth. So I've found that TRE also helps with a lot of that, and particularly with sleeping. So if you've been feeling particularly stressed, then even just doing 5 minutes or less of TRE, I find that I could then fall into a deep sleep, and so have many clients. So it's been great for that as well.
Well, I'm Katrien. I hope to be TRE provider soon, but I took a pass from the course to give birth, actually. I think there's the story about TRE itself. The first time I did it, it wasn't really a good experience for me. The emotions were very, very intense. It still got me interested in what happened. And then I think where the story of giving birth starts is with the word confidence for me. Confidence in that your body just does what it needs to do. Because that were my following experiences with TRE. They were all like good or even great. And my confidence in my own body started growing. During the course, I got pregnant for the second time. And that's then the second part of the story, that I gave birth 2 times in a similar way. It was 2 times in the hospital because of complications with the pregnancy. I'm sure even that TRE helped a lot because one part of my body was temporarily paralyzed. I couldn't feel a lot, but the other part was still very active, and there was a lot of release, a lot of shaking just happening with me. I had no control, but I remember with the 2 births, people telling me this is normal. Also, the shaking is normal. It's adrenaline in your body. It will stop a while after giving birth. I think because of all the experience I had built with TRE, I just recognized the release, the tremors. I also wasn't afraid of all the tremoring of my body. And that helped me to focus also on other things, like to see her for the first time, my daughter, to feel her, to keep talking with people around me. That was TRE during the birth. Yeah, I even recall thinking to myself the 3 layers of the polyvagal theory, like just keep in this ventral mode, and the shaking is one part of it. It's not a problem. It's not something to be scared of. And I'm glad. I'm glad I had this second experience. After the birth, of course, yeah, my body was quite painful. So the first 2 weeks or 3 weeks even, I kept it really calm, didn't move too much or try to. But after a few weeks, at some moments when I was resting, for example, in my bed, lying on my side and breastfeed my daughter, so we are belly to belly. It's very nice and cozy. I also felt spontaneously again some tremoring. I remember it also as being really relaxing, feeling confident, it's all right. And then also falling asleep very easily, in a very deep sleep. For me, also tremoring in the pelvic area. That was very, I had different feelings, like emotional. So I think I'm just at the beginning, and I hope TRE will help me to recover from all this. Yeah.
So my name is Giorgia Torre, and I'm a certified TRE provider. I used it throughout my pregnancy and during the birth and the postpartum period as well. During the pregnancy, I remember in the first trimester, there was a period when I had, especially in the middle of the night, I used to wake up in a lot of pain in the lower abdomen, and I was quite like strong cramps. I think it was the uterus trying to expand and make space for life. And so at that point, I started using TRE and shaking and sort of creating some. It really helped me to go through that pain, creating space and creating warmth in the area. So from really contracting, then just opening, and that was really, it brought a big relief. So it was really more of a, yeah, really helpful for that type of experience. Then during the second trimester, I used to shake on my back, and so I did 2 days of full, shaking quite a lot, and it was really nice. And I brought a lot of relief on my lower back. And as well during the third trimester, I used to do it mainly, I think, for the lower back. During the birth, in between the contractions, there was this time of pause, and that's when my body felt the need of shaking, and then I followed and listened to that. And so there was the contractions with the contractions, and then shaking that really helped. And I think, I helped with the coping with the pain, but also with the breathing, and also, I think it saved my perineum at that point as well, because I didn't have any tears. When you become a mother, then you don't have that time anymore. And so I believe the TRE is actually really good for having those 5 minutes or 10 minutes to yourself, just to, relax your muscles, don't think about anything, just being yourself. And, you don't have often much time to do yoga or walking, and but you can take time to just shake for a little bit. So that's, yeah, I do that sometimes in the evenings when I wake up. And my daughter now, I don't know if it's because I shook a lot when I was pregnant and during the birth, but what she does now is when she gets really excited about something, she does, and she shakes. And I asked around, I was like, is anyone else doing this? And everyone is like, no, never seen a child doing that. So she does that very often, like, ooh.
So my name is Nina. I'm a TRE provider in Amsterdam, in Holland. I'm a TRE provider since 2015. And actually that was also the time I got pregnant and gave birth. to my firstborn, Rio, and I have now 2 children. So I was familiar with TRE before getting pregnant. I wrote a blog actually on my website about what I found during my pregnancy, about information about tremoring during birth, for example. There is actually almost every pregnancy book here in Holland talks about tremoring during giving birth, and that it's a normal experience, but not any book explains why it happens. So then I was like, okay, so it is part of giving birth to tremor. So it is a natural experience, and it's a well-known fact that it happens. So why shouldn't I tremor my pregnancy and not while giving birth? Now here's my firstborn waking up. If you find my video, the first video I did about TRE and giving birth, he was born there. So I think he felt the excitement about me having this interview, and he is not able to sleep. His birth was actually a long time. It was almost 20 hours. The thing about the adrenaline, that it's like closing the utero, really helped me to feel very confident about doing TRE while being pregnant, in the sense that I felt it's important that I have less adrenaline in my body when I'm going to give birth. I do think that the exercise stretching the psoas muscle, like leaning backwards, that it irritated the belly muscle in the end of the pregnancy. Like at 8 months, I was not able to do that exercise during a workshop, for example. But yeah, it needed little adjustments, and then also laying flat on the back was not very comfortable. It was better to lay on the side or sitting up a little bit, or with this pillow in the back that you hear from other women as well, that it's nice to have something to lean against. So that's also how I did my TRE while pregnant. And when I was giving birth, I felt like it is impossible to breathe away this pain. It's really painful, but I can be there and I can be with this experience. And I felt my body was shaking it out, shaking away the pain. And then I was able to sleep for like 1 minute. And then another wave was coming. I could be with the pain, and then I was shaking it out. And that really helped me going through labor. And I felt in TRE, I could just be with the pain and feel that my body was really trying to help me going through the experience, and help me finding ways to move with the pain. And that was very helpful. I found it very helpful to explain my midwife what is TRE. Actually, the second birth I did, I gave a workshop to the midwives that were involved in the birth, so they would know and feel what is TRE, so that I could just use it and they could help me and stimulate me doing it. But what I then heard from them is that they recognized the experience, they recognized the movements of TRE, or the tremoring of TRE, in every birth. And so I made a video of their perspective on how they see tremoring during birth as well. And I feel TRE is a huge opportunity for women to experience how your body knows what to do. And if you have confidence that your body knows what to do, in the sense of self-healing, in the sense of helping you go through experiences, then that confidence is so helpful during giving birth, because that's when you feel, oh my God, what's happening? And I never felt such an intense experience. And in that moment, if your body starts tremoring and you recognize, wow, my body is in this moment is here with me and it's helping me, is so helpful. And so it's really, yeah, I would wish for every woman to know how TRE works, how tremoring works for you, to use it. And of course, also after giving birth, I took about 6 weeks to really heal from giving birth, because they always said my pelvic floor was very tight. So I was actually a bit afraid that I wouldn't be able to give a natural birth, but I was able to do it, and without any intervention. So in that sense, I do believe that TRE helped a lot to open the space and to be able to relax into my body. And after the 6 weeks of healing from the birth, I mean, for me, it was like after the bleeding stops, then I can again start doing TRE. And when I did TRE after giving the first birth, like the first 6 or 8 times I did TRE, it was very orgasmic. And I was like, wow, that's amazing. It's really, the whole birth canal is healing itself, is moving and tremoring and finding ways to deal with the experience. That was really beautiful. Yeah. It made me realize that it's tremoring is actually about healing experiences, in the sense that I could relate to the tremoring where it was happening. I could feel that's where I just had the experience, the most difficult experience of my life, and it's healing itself. Yeah.